To help us understand this new surge, where we're headed, the difficulties that Omicron poses, is Chief Innovation Officer at Boston Children's Hospital and ABC News medical contributor, Dr. John Brownstein. Dr. Brownstein, thanks so much. Hope you had a good holiday weekend.
Thanks so much, Phil. Hope you did too.
We appreciate you being here. Well, people nationwide gathered to celebrate the holidays, Christmas this past weekend. On Thursday, the U.S. averaged nearly 161,000 new daily COVID cases. That is up 36% from the previous week. If you find out right now that you were in close contact with someone who had COVID, and so many people are doing that, especially after this weekend, what should you do, and how does your reaction differ if you're vaccinated or unvaccinated?
Yeah, Phil, this is the message that I got all day long, every day throughout the holidays. So many exposures, so many unique situations, a lot of anxiety. The reality is it is different if you're vaccinated versus unvaccinated. Unvaccinated, a person needs to quarantine for 14 days. Local guidelines might change that to about 10 days or 7 days with a negative test, but you really need to go right into quarantine immediately after that exposure. If you're vaccinated, and you don't have symptoms, you don't have to quarantine according to CDC, but you should be getting tested a few days later. And remember, if you do have symptoms, go right into quarantine as well. And a test may not show up as positive for a few days. So even if you get that rapid test immediately, you're negative, but you have symptoms, you should be considering yourself quarantined and isolating until you get additional testing done. We just all have to do our part to reduce transmission. This is a very fast moving variant. So whatever we can do in terms of limiting mobility, masking, social distancing, this is how we're going to get through the next 3 weeks.
So we know that it's a fast-moving variant. There's some data that suggests it may not be as severe as Delta. Sort of the jury's still out on that right now. But this is what everybody wants to know, and they did with Delta. They do now. Is there any clear data that tells us how long people are contagious? When you get it, are you contagious just before? Your symptoms? What's the data show us?
This is really challenging. Obviously, with a new variant, there's different metrics, but different people will be contagious for different times, and this will change based on variant. It's not clear cut. It depends on your immune system's ability to clear the virus, that timing, and it depends on if you were vaccinated or previously infected. It could be a matter of 2 days. It could be 5. Rarely 10. I think we're going to see changes in isolation guidelines because of that. Data suggests that with Delta variant, you have a shorter contagious period. I'd assume with Omicron, it's even shorter. But the only way to know is through testing and making sure that you get an understanding of whether you're positive or negative, and doing that multiple times, because a rapid test tells you whether you're contagious now, but it doesn't necessarily tell you if you're contagious tomorrow.
And so the things we know, or one thing we know, Omicron is spreading very fast, faster than Delta. But the unknown, I think, scares a lot of people. The shortage of testing is a major issue for this country right now. We saw fighting in Bushwick, Brooklyn, at a test distribution site up in Westchester. We know that a site ran out of tests in 47 minutes. So someone standing in line an hour before they opened couldn't even get a test. As an epidemiologist, what are your thoughts on this shortage right now? You heard the Biden administration say 500 million free tests are coming, but it's not soon enough, right? We should be testing everybody right now whenever they need it.
Frankly, we should have been better prepared for this. We knew a new variant was going to emerge. We knew testing was our sort of ticket out of the pandemic, and we were caught flat-footed again. Testing now a bottleneck. And so the challenge really now is, how do we get people to test and understand whether they're infected so they can isolate? So unfortunately, now if you don't have access to a test but you have symptoms, you should consider yourself positive until you finally can get that test. Rapid tests are going to be super critical to basically helping deal with that sort of load of testing that's out there. But for now, if you don't have a test, just assume that you need to quarantine until you get that access.
Well, you mentioned the type of test. Let's talk about that for a minute. Explain the difference for us between PCR and rapid antigen tests, and whether one might be better than the other, and does it depend on the situation? There's obviously a lot of confusion about this, and with the testing shortage, what you can actually get your hands on.
I know, and whatever test you can get is better than nothing. PCR is the gold standard, but remember, PCR gives you an indication if you're pre-contagious, contagious, and post. So while it's a very sensitive test, the rapid tests are super critical because they can tell you right now whether you're contagious. Oftentimes, PCR tests only tell you too late about whether you may have had virus before. The rapid test can be really useful right now, especially if you're gathering or going on a flight. Try to get access to those, but yes, the PCR test is especially the gold standard standard to know whether you've been, exposed to this virus and potentially early on in the infection period.
A couple of questions for you here on kids. Earlier this month, the American Academy of Pediatrics reported that COVID cases among children are extremely high. This is sort of a twofold question. First of all, does that surprise you? Because with more cases, one would think that, yeah, more people are going to show up in hospitals, including children. Or is there something Omicron is targeting in children?
We don't yet know whether Omicron specifically is more severe in kids. We don't necessarily think so. Remember, it's still a large chunk of our population that's unvaccinated is our kids. About only a third of kids under the age of 18 are vaccinated. So that's our vulnerable age group right now. And so unfortunately, with a very fast moving virus, our kids are going to be vulnerable. And especially those under 5 who have yet to be to access the vaccine, we have to be incredibly concerned. And yes, that's why we're going to see that increase in kids. That's why it's so important for the adults and older kids to be vaccinated around them, cocoon them, make sure that they're protected, do whatever we can to keep masking, social distancing, avoid large crowds, especially as we're in the middle of this surge.
All right, and just finally, looking at South Africa and other areas across the globe that have faced this Omicron surge, when can we expect to see these numbers subside? And are we watching other countries to see that, or might we not be following in their footsteps?
Well, I think it's sort of a double-edged sword. On one hand, you do want to look at South Africa, and they experience a rapid increase and a rapid drop. But we look different. We have different demographics. We're in the middle of a Delta surge. When Omicron came, we have mobility with the holidays. So I don't want to hang our hats on what happened in South Africa. In the UK, we're still seeing increases. So our context is different. It is great to see, that this virus could spread quickly and move along. That's what we hope, but we shouldn't plan for that. We could still deal with a significant surge, especially as we're entering the New Year's period. A lot of people gathering. That does create a little bit of a concern for multiple super spreading events in the coming weeks.
Dr. John Brownstein, thanks so much for your expertise. Seems like every time we talk to you, we feel just a little bit better about what's going on around this country and around the world. We do appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.